All right, here we go. I hope you all can hear me. So I'm on live. This is the health party, y'all. The anticipated on live health party. I'm Dr. Katina. You know who I am, nurse practitioner. This is one of several weeks of different health topics that I'm going to be talking about. This is the health party. So I hope that you have your drinks, your beverages, your water, your dinner, and you're joining me. Or if you're driving home, you're listening in with me. I have IG to my left, so I'll be talking to IG as well. And then I have Facebook here. So everybody on Facebook, Rochelle, Renata, can you hear me okay? The reception is good. Let me know. I know IG is good. I can see you all over there. So this discussion, we're going to be talking about fibroids. So men, it's okay. Men, you can join in as well, because you may be impacted with when it comes to fibroids as well, because fibroids, and we'll talk about this, but fibroids can cause a lot of vaginal bleeding. So that can interfere with sex. So you men have to be understanding of that, okay? So you can join in so that you can learn more about fibroids, because you may actually, your partner may actually have fibroids. So this is for men and women. Everybody can join in. It's okay. Just waiting for a couple people to join in. Let's see. Trying to see if I can share this. I guess I was supposed to share it initially, but oh, thank you, Trisha. Thank you. Y'all all right over there, IG? I'm going live. This is the live health party, IG and Facebook. All right, so let's get down to it. Yeah, share it. Share the live video. I don't know how to share it on my end. I guess at the end, I'll share it as well. If you're on Facebook, just share it so that you can pass this information on. Remember, I do this because I love to do it, and I do it because I'm bringing health awareness. This is a part of my Know Your Health Status campaign. All right, I know you all have heard me talk about knowing your health status. And knowing your health status is just a part of health awareness. All right, knowing about your health. I don't know if you all were able to listen in my interview yesterday with Erica Campbell, her radio show. But that was a great radio show that I was talking about know your health status, the big three. So let's go ahead, jump in it. I got some questions. Sheila is already asking me, do fibroids shrink when you get older? Fibroids, they do shrink after menopause. So let's talk about fibroids. So what is fibroids? I have like just my little cheat sheet so I can cover every aspect for you guys. But fibroids are basically benign tumors that are on the uterus, and what causes them, they really don't know what caused them. But let's talk about some of the symptoms. Some of the symptoms can be heavy bleeding, low back pain, painful sex, really, really heavy periods and long periods. Fibroids, they call it, they say, for lack of better words, are the devil. They can be the devil, especially if you've actually, if it depends on the size of them and how many you have. So we know that the fibroids can also cause constipation. It can cause difficulty urinating. You'll feel a lot of pressure. I have some people backing me up. Yes, definitely. Those are some symptoms of fibroids. And then sometimes you may not have any symptoms. Sometimes during your pelvic exam, when you come into the office, we actually may do a pelvic exam, and we'll feel the uterus enlarged, and then that's when we'll send you for an ultrasound, and then that's how it's diagnosed, through a transvaginal pelvic ultrasound. So a lot of you all are having those symptoms. And so let's see, let's go to the causes. All right. Now, we hear a lot of things out there, all right? Fibroids, we hear a lot of things out there about the causes. The research shows that genetic changes, sometimes it's just in the DNA. And that's why in the African-American population, fibroids are more prevalent. Believe it or not, it's more prevalent. So genetic changes, also hormones. That's the main, that estrogen. Estrogen, we need our estrogen or hormone, but the estrogen and progesterone feeds the hormone and the estrogen and progesterone hormones feeds the fibroids. And guess what? It causes it to grow. It causes them to grow. So it's the hormonal issue can be a problem. What are some other causes? They say certain foods that you're eating can be a cause, but then again, that's all speculation. That's all speculation. They really, really don't know what's causing. They just know it's prevalent in African Americans. It can be genetic. It can be hormonal. And some of the risk factors can be environmental. So a lot of my obese patients, overweight patients get fibroids because a lot of the adipose tissue, which is the fat tissue, hold like a lot of the estrogen. So the estrogen, again, that's the hormone. The estrogen is what feeds the fibroid. So that's why, to answer your question, Sheila, after you become menopause, you don't have that estrogen to feed the fibroid anymore. So guess what? The fibroid shrinks. So you are correct. That does happen. Also, they're saying that, of course, certain birth control, because that goes back to the hormones, vitamin D deficiency. You all have probably heard of the vitamin D being low. Some research shows that can cause fibroids. Again, these are just some all environmental factors that could cause that. And of course, you've heard of that, eating a diet high in red meats, eating a diet high in red meats and drinking alcohol. So all of that can, they've studied can cause the fibroids. Now, let's talk about the complications, some of the complications of fibroids. The reason why they're an issue for many of us, or many women, is because, remember those symptoms I talked about earlier, that painful sex? Remember, they talk about the heavy bleeding. And when you have the heavy bleeding, guess what? That leads to anemia. So when you become anemic, iron deficient anemic, then you start to feel tired. You start to feel weak. Some people have to have blood transfusion because their blood actually drops really, really low. So some people have the severe chronic low back pain. Some people have frequent urination where they lose control of their bladder because the fibroid / tumor is actually compressing on the bladder area. So when it gets to that point, that means the fibroids may be in a specific area that's causing complication. Also, they may be large. You could have one large one, and that can cause some issues as well. So those are just some complications. Now, we talked about, let's go back. We talked about what a fibroid is. It's basically a benign tumor. All right. We talked about the symptoms. I like to recap, summarize. We talked about some of the symptoms, some of the causes. We also talked about some of the risk factors. Race is a risk factor. Black women, right? Hereditary. And then it shows that some diet has something to do with it, but a lot of my vegans and vegetarian, they still have fibroids. So, you do want to stay away from a lot of the red meats, but also chicken has the hormones in it. So that can cause increase the estrogen levels in the body. And again, the hormones is what feeds the fibroids. Now, a lot of times when you all go to your GYN, they would want to give you, to stop the bleeding, because remember, the bleeding is what caused the complications. So they would want to stop the bleeding, and they would want to give you what? Birth control pills, all right, or a birth control. And that might not be good for the growth of the fibroid. So it'll help stabilize you for the time being. But as far as the fibroid, that the birth control that they give you may actually cause it to grow. So just always remember that. So how do we treat this? All right, how do we treat the fibroids? That's the big thing. It all depends on the size. It all depends on how many you have. It all depends on where you are in life as far as are you going to have any more kids and things like that. So some of the options are you ready? Write this down if you have fibroids. You have the UFE, which is the uterine fibroid embolization. And that basically cuts off, it like burns a certain part of the artery there, vessels that feeds the fibroid. So you can have a UFE. I see Melinda says she don't want to have surgery. That's a minimal invasive surgery. And all you have to do, they depending on, like I said, how many you have and how large it is, that's a UFE. So they'll burn off the blood supply to the area. And guess what? The fibroid will shrivel up and die. But guess what? That's to that fibroid. Unfortunately, other fibroids may grow throughout the uterus. May or may not, all right? But again, the UFE is another option. Also, yeah, Sheila, you say you tried that. A lot of people have tried that first, and then, like you said, what happened, Sheila? More came back, more fibroids came back. All right, so we have the UFE, we have the MRI guided ultrasound. Not too many people do that, but that's basically like another option where they go in and they do what they call a myosure, just kind of break up the fibroid. That can't be too large because, again, that's something that can happen that can be done in the office. Some gynecologists do that in the surgical areas as well. So that's another option. So the UFE, your MRI guided ultrasound, where they break up the fibroid. But again, when they do that specifically, more fibroids may grow. So that's just the downside to those first two. And then you have the endometrial ablation, where they just kind of burn off the part of the endometrium, which will prevent it from coming up, from growing again. And then also myomectomies. You all have heard of that. If the tumors are large, the fibroid tumors are large, they basically they'll remove the tumors. So that's what a myomectomy is. They remove the tumors. And then we hear about it all, the hysterectomy. Now, they don't have to remove your ovaries, but they will remove the uterus, because after you're finished having kids, in actuality, you really don't need your uterus anymore. So if you get recurrent fibroids, or if you have multiple fibroids on your uterus and the other options that I mentioned is not an option, then you definitely will have to consider a hysterectomy. I have Miss Erica. Erica is talking about robotic hysterectomy. Basically, robotic hysterectomy is when they just go in, make small incisions, and they remove the uterus. They remove the uterus. They leave the ovaries, because if they don't leave the ovaries, you're going to go into menopause. And you know what happens after menopause. So you want to have them to keep your ovaries if you have a hysterectomy. Unless, of course, you have cysts or unless you have tumors or abnormal cysts on the ovaries. But you definitely want to go ahead and, the robotic hysterectomy is a good option. It's a really good option. But again, you want them to leave the ovaries. Let's see. I thought the ablation just helps with the live. No, remember, Erica, when they do the ablation, they're burning part of the uterus. So, that area is burnt. The area is dead. So, it won't continue to grow. So that's what the ablation is. They'll burn that area, Erica. So you got it. Okay, good. I'm glad, because remember, if you have a hysterectomy and your ovaries are removed, there goes your sex drive. I can tell you now, there goes your sex drive. So a lot of my patients lose their sex drive after they have a hysterectomy if the ovaries are removed. But a robotic hysterectomy is the least invasive. That's better than that big cut. You have a really good recovery time as well when it comes to a robotic hysterectomy. So those are some of the surgery options. Let's see if I can read some of these here. I'm gonna be there. Yeah, sometimes it depends on, as far as like you have a lot of fibroids and they do a myomectomy to MAR. Fibroids can sometimes interfere with pregnancy. It depends on where it's located. Not all the time, though. I have a lot of patients that have successful pregnancies. They do have extreme back pain, though, because remember, as the uterus grows, that fibroid grows as well, and the fibroids tend to grow during pregnancy, because again, there goes the hormones. All right, some natural ways. All right, because I know I have, you know, some of my some of my vegans out there, my naturalists. So I did look up some natural ways, and I've actually heard quite a few of my patients, not just a couple, but quite a few of my patients, they've actually tried some of these. Now, when it comes to natural, you do want to check with your healthcare provider, of course, before you start anything. And natural takes a little bit longer, so you may not get any results right away. But for those of you all who do want to try something natural, they have the Chastleberry. I don't know if you heard of that, but Chastleberry is a good one, also known as Vitex, V-I-T-E-X. All right, Chastleberry, that lowers the estrogen level. Remember, the main culprit for fibroids is what? The estrogen. That's what feeds it. So you got to watch your foods that's high in estrogen, which is some of the things that we just talked about. Also, a lot of you all drink green tea. So the EGCG that's in the green tea actually helps inhibits the fibroid cells growth. So green tea, for those of you all who like green tea, you drink it about 2 cups a day, 2 to 3 cups a day. And again, that's been researched that will help. Yes, Sheila, Vitex, V-I-T-E-X. So those are some natural ways. There's so many different ones that's out there, but these are the ones that I've known my patients to use that it worked really well for them. So the Chastleberry and the green tea. All right, let's see. And again, when it comes to just preventing things, okay, good. So Renata, you drink green tea every day. So, you know, you may or may not have fibroids, but, you know, and remember, be careful with the green tea, because some green teas, you know, have caffeine, some don't. So just be careful with that if you have high blood pressure. All right, because remember, caffeine can raise the pressure. So although these are some natural things, again, you want to check with your provider and just make sure that that's something that you can do. And remember, make sure you all share this. Make sure you all share this live video, because this is great information on fibroids. I get a lot of different inboxes regarding fibroids, and so will this shrink them? Erica, to answer your question, someone asked, will the natural ways that I just mentioned shrink them? It'll stop the production of it. So it may not shrink it, because remember, when we talked about what feeds them. So it may not shrink it, but it will stop the progression of it. Yeah, so it'll prevent it from getting bigger. All right. And again, when it comes to natural, it takes a lot longer. So it's important that you stay away from like a lot of red meats. Eat healthy. Weight loss. I know I say that all the time. It's part of my Know Your Health Status campaign. Let's talk about that again. Know Your Health Status campaign. It's important that you exercise, eat healthy, because when you're overweight, or when you're obese, I shall say, overweight, I'm overweight. When you're obese or morbid or obese, that can actually, you know, just cause a lot of complications. That can cause something called the PCOS that a lot of women have as well, polycystic ovarian syndrome. So you want to eat healthy, exercise, eat your fruits and vegetables. And those are just some ways that may decrease your risk. But remember, we talked about those other risk factors. The risk factors such as what? Genetic. The risk factors such as what? The race, you know, being African American. So you can change your diet. I've had a lot of vegans and vegetarian that actually changed their diet, and the fibroids actually have shrunk. So watch your soy products. You should not be eating things with soy in it. I know you all have heard that before, because it increases your estrogen level. All right. You want to say hi? Come on. Come on, Trooper. I have my little doggy here. Everybody say hi. Look, look, look. Hey. Yeah, so, you know, that's like the gist of the fibroids. We talked about a lot of things, and the most common questions is about the hysterectomy. Should I get a hysterectomy? If your uterus is filled with fibroids, that may be the only option, unfortunately. But if it's not, then, you know, you may be able to do some natural things. You may be able to start with the UFE, the embolization we talked about, and so forth. So I'll take some questions for a little bit. Don't forget, I have my reminders here. All right, so April 22nd, my master class. Make sure you sign up for that. That's on Eventbrite, only $19. I have a secret formula to keep your vagina healthy. All right, so make sure you sign up for that. I'll put the link in my comment section soon, but you don't want to miss this master class. It's going to be very informative. I know a lot of women suffer from vaginal infections, vaginal dryness, decreased lubrication, and things like that. So my master class on secret formula to keep your vagina healthy, that's April 22nd. That's on a Sunday. So everybody can join me in then. And then also health party tour. So this is the online, let me put my little doggy down. Aww. So the health party tour. So I do health parties all over the United States. So if you want to book me for your health party, let's have one. It's fun. A health party is basically what we're doing now. We're talking about health, but of course we have music and we have food and drinks, and we have a good time. So this is just part of my Know Your Health Status campaign. We're doing this every Thursday for the next, I think, 8 weeks. We're going to be talking about healthy, because a lot of people are like, what is healthy food, or what's a healthy diet? So I have some things coming out we're going to be talking about healthy diet. We're also going to be talking about nutrition, sex drive, how to increase your libido. So I'll be posting it week to week. Join me every Thursday. We'll talk a little bit about a lot of different topics. I'm glad you all joined me for the health party tonight. I hope you all learned some things. Make sure you share this. Go back and review this. I'll post it, and we'll go from there. All right. Until next time. Health party, hey. All right, great. So I'll see you all next time.